Action.
Hello! This is Ms. Mesa Abdullah, without the H. My name is Ignacio Valle Jr., and our presentation is on aortography. We're going to be talking about what aortography is, what it detects, its indications, its contraindications, and the procedure itself. So let's get started. What is aortography? Well, aortography is an imaging procedure by which the aorta and its main or its branches can be seen on X-ray film. And that's after the injection of contrast medium, which is what we're going to talk about next. I'm sorry, what it detects. Aortography detects aortic aneurysm and assesses the severity of PAD, which is the peripheral arterial disease. Now those things are important, and this is before surgery. Now they're important because they tell your physician the kinds of treatment that he is going to be giving you, and it also gives them information about your heart, what it's doing, how efficiently it's pumping blood, and also the kind of pressure that's building up in the blood, in the heart. So what contrast medium is used? The common one for this procedure is iodinated contrast. Now it goes by many names, it has different names, but it's all the same thing. One name, for example, is Lopomiro, and it's usually injected into the aorta through a catheter. And that catheter can be placed in two locations, either the femoral artery at the groin. Do we all know where the groin is? Okay, good. Or the brachial artery and the inside of the elbow. Now the femoral artery is usually the main location where it's put. The brachial artery is a secondary route, and that's only if the femoral is not readily available. So your physician will use the other. Here are some of the instruments that are used. A pigtail catheter, a guide wire, a power injector. The pigtail catheter comes in different sizes, and the usual ones for this procedure is 4 to 6 French gauge. A guide wire, which is very important because the guide wire is responsible for putting the catheter, properly at the site that needs to be examined. And the power injector is responsible for transporting the contrast to the site that's being examined. And this is the pigtail catheter, this is the guide wire. Ms. Abdullah here, she's going to get into how these particular instruments are used and go through the procedure. Ms. Abdullah?
The procedure can be divided into 4 phases. The first phase is patient preparation. The second phase is catheter placement. The third phase is filming. And the last phase is patient dismissal. Phase 1 is patient preparation. The first thing that the nurse or the doctor is going to do is trying to obtain a patient consent. What they're going to try to do is explain the procedure to the patient, then give them a form to sign so they can continue on with the exam. Next, the X-ray tech or the nurse is going to set up a table. This is a sterile procedure, so you have to be careful not to contaminate it. Your table is basically going to be set up for the... I'm nervous. The table is a sterile procedure, so you have to be careful not to contaminate it. It's going to contain your basic surgical equipment, like your scissors and your scalpels, the gloves for the doctor, your gauze. Also, it's going to contain your catheters and your guide wire and the anesthetic that is going to be used. Also, the patient is going to be monitored throughout the whole procedure. So your heart rate, the patient's heart rate is going to be monitored as well as blood pressure to make sure that nothing happens to the patient. Then the nurse or the tech is going to either shave and sterilize the site. So when the doctor is ready for femoral access, which what he's going to do is going to palpitate for it to find it. And that's when the procedure start. The second phase is catheter placement. So when the doctor finds the femoral artery, he's going to administer a local anesthesia, which is usually lidocaine. Then he's going to access the vessel, which is the femoral artery, by making a small incision. Then he's going to thread the guide wire through the artery into the aorta. Once that's done, he's going to insert the catheter over the guide wire into the aorta about 2 centimeters above the aortic valve. Then once the catheter is in the proper place, he's going to remove the guide wire. Then when the physician is ready, he's going to insert the contrast into the heart to visualize the vessels in question. Phase 3 is filming. The technologist operates the injector and the filming equipment to produce the desired radiographs. We also process the image and prepare the images for the physician to view. The amount of films that the physician takes is up to him. Some physicians like to take a lot for a thorough study. Some are more specific. They want certain pictures. Sometimes the doctors do it themselves, or they tell the tech when to fluoro. The last phase is patient dismissal. After the procedure is done, the doctor or the nurse is going to place pressure on the femoral artery for about 4 to 10 minutes. Then they're going to place a pressure bandage to make sure that the patient doesn't bleed out. After that, they explain to the patient that they have to lie still for a few hours, and they prefer that you don't walk for about 4 to 8.
Now here are the more common indications. Well, actually they're not so common. Only the first two are pretty much the main indications. That's aortic aneurysm and aortic dissection. And the aortic aneurysm is pretty much just the ballooning of the aorta. It inflates to an abnormal size. And the dissection is small lesions or tears in the aorta, and that's bad. And the rest are not so common. But regurgitation, all that means is that the blood flows backwards into the valve. And stenosis is the narrowing of the valve, which constricts blood flow.
Some of the contraindications of this procedure is people with impaired kidney functions because they have a harder time flushing the iodine out of their kidneys. Also, people with diabetes and people with a history of allergies to contrast because they are at a greater risk of anaphylactic shock. Some people have minor reactions like itching and vomiting, and some people have super major reactions like loss of consciousness, dyspnea, and tachycardia.
We realize that there's a lot of information there. Some of you may have not caught it. Some of you may not have been paying attention anyway. So we provided a video for you to watch, and that's going to go step by step of what we just talked about, and then we can have a visual cue of what we were saying. Maybe not. Yes. Maybe yes. Oh. Do it again. We don't control how it sounds. Okay, well, restart it. How do you restart it?
I think you opened it twice.
Just mute one of them.
There you go. You can use the mouse.